Well, there are a variety of hidden healthcare costs that can drive up the prices that patients end up paying out for. One, which maybe doesn't get enough conversation, is that of in-hospital infections. Betsy McCaughey is the former lieutenant governor of New York State. She's also founder and chairwoman of the Committee to Reduce Infection Deaths. Betsy, welcome to the show, and thank you for a couple of moments today.
Well, thank you very much. This is an important issue because it's the biggest risk that patients face when they go into the hospital. Hospital infections kill 100,000 people a year. That is infections you acquire after you go into the hospital. So they kill more people than car accidents and breast cancer combined, for example, but they get much less attention. And they also make the big difference between the profitability or financial failure of a hospital. Improving infection control can literally turn a hospital's bottom line from red to black.
So with that kind of financial impact, why is it that seemingly it's a topic that doesn't get enough conversation right now?
Well, it's often because of the way hospitals are managed. The top management of the hospital isn't involved in ensuring that infection prevention protocols are carefully observed, and most importantly, that hospitals are effectively cleaned. You may be surprised to hear this, but what is the number one predictor of who contracts a hospital infection? It's not your age, and it's not the diagnosis or disease that brought you to the hospital. The number one predictor of who gets an infection is what room they're assigned to or what bed they're put in. If a patient is assigned to a bed or a room and a previous patient had an infection even 2 or 3 weeks before, I'm not just talking about the immediately previous patient, but if somebody in that room 2 or 3 weeks before had an infection, your risk of getting that infection goes up by 583%, almost sixfold, according to the Columbia School of Nursing, because the previous patient was discharged, but their germs weren't. They're still left on the bed rail, the over-the-bed table, on the call button, on the television controls, on the privacy curtain. Inadequate cleaning is the number one cause of these infections, such as Clostridium difficile, the most numerous infection, MRSA, methicillin-resistant Staphylococcus aureus, vancomycin-resistant Enterococcus, or Acinetobacter. All of those infections were studied by the Columbia School of Nursing and have found that the number one predictor is inadequate cleaning.
Should I be surprised that that is a significant problem in today's day and age? And I ask that because you would think that in a hospital setting, cleaning, especially after a patient had been in a room or a surgical suite or wherever in the hospital, would need to be, if not, topic number one, but maybe 1A in a hospital setting?
Well, unfortunately, the environmental services staff has high turnover. They're not adequately trained. And as a result, I'll give you an example, a survey done by Dr. Michael Perry at Stanford Hospital in Connecticut. He's one of the world's experts on environmental cleaning in hospitals and the connection to infection, and he happens to be a board member of Reduce Infection Deaths. He did a survey of 1,100 hospital rooms all the way from Washington, D.C. to Boston. The really premier hospitals, Yale, NYU, Columbia, Harvard, Brigham Young, all these top drawer hospitals on the train from Washington, D.C. to Boston, Brown University. And what did he find? Over half the surfaces in a room that are supposed to be cleaned when one patient is discharged before the next one is admitted to that room are left untouched by the cleaners. Just to give you an idea, the bed rails, the over-the-bed table, often overlooked. I always say to people who are studying this issue, if you have to eat your lunch in a hospital room, the safest place to put your sandwich is on the toilet seat because that's the one object that is never overlooked. Funny, right? It's funny. But,
it's funny and scary.
It's really no joke. The inadequate cleaning. And, of course, there are many remedies. We have several studies to show that if you work with the environmental services staff to show them the surfaces they're overlooking and the importance of drenching and waiting instead of the quick spray and wipe, you can dramatically improve the effectiveness of cleaning and bring down your infection rate. Robert Ernstein at the Mayo Clinic showed that by wiping the high-touch surfaces around the bed once a day with the Clorox bleach wipe, he reduced C. diff, Clostridium difficile, 86%. Well, why isn't every hospital doing that? Can you imagine? And now there are some high-tech methods of automatically, continuously disinfecting a hospital room so that you can literally guarantee each patient who is admitted to that room, it's like the tape they used to have over the toilet seat, a disinfected room. There's a diluted hydrogen peroxide. Several companies provide a method of putting that into the HVAC system. There's far UV light. So hospitals really need to embrace the science behind these new methods of automatic continuous disinfection.
You also note that it's not only the cost that ends up being associated with the healthcare facility, but obviously the individual who is impacted by this, whether it be by a potential death or them being out of work longer than maybe they should be. There's a financial impact on that side of the story as well.
Oh, of course. And I found it weird because I was so concerned about the death toll and the suffering from hospital infections. When I was lieutenant governor, I just heard about it over and over again, the same story. I brought my mother or my father or my brother to the hospital, and they contracted a deadly infection. But if we're trying to convince hospitals to clean better, and that is the number one issue here, we have to show them that we can turn them from red into black, right? They should also be concerned about their reputational costs. And frankly, hospital infection could be the next asbestos, the next major cause of class action litigation.
Yeah. What's the path then outside of awareness and doing interviews like this to try and reduce those numbers?
Well, on the hospital side, we provide a lot of information on how to better train your environmental services staff and monitor the effectiveness of their cleaning. On the patient side, and we're really dedicated to educating patients and their families, we have a kit now, a kit that you can actually use to prepare yourself for your hospital stay and bring it to the hospital with you. It has all the tools in it that will enable you to reduce your own risk. For example, if you're having surgery, knee surgery, hip surgery, cardiac surgery, the studies all indicate that bathing with a liquid soap called chlorhexidine, that's not a brand, it's a type of soap, for 3 to 5 days before your surgery removes the dangerous bacteria on your own skin that could migrate into your surgical incision and cause an infection. Well, that's one of the items in this kit. So if you come to our website, hospitalinfection.org, hospitalinfectionsingular.org, you will see lots of information, a book called Unnecessary Deaths with all the data in it. You'll see how to order a kit. You'll see a lot of information that hospital board members and managers can employ to reduce the risk of infection in their hospital.
How much, or I should say, Betsy, where can people find out more if they would like to learn more about what the work that you guys are doing?
Well, please come to our website, hospitalinfection.org, hospitalinfectionsingular.org. We have a huge amount of information on that website. It's all designed to help patients, or on the other hand, to help hospital and managers and doctors help patients reduce infection.
Great to meet you, Betsy. Thanks very much. Good luck with the work.
Thank you.
Betsy McCaughey, former Lieutenant Governor of New York State, founder and chairwoman of the Committee to Reduce Infection Deaths, or as she referred to it as RID, R-I-D. Well, we are seeing a growing number of